On August 1st, 2019, Wisconsin first alerted the CDC about a cluster of pulmonary injury among young adults, and that had begun in July of 2019. CDC implemented an incident command structure at that point. And then on September 16, 2019, we activated our Emergency Operations Center, which allows us to bring in more dedicated staff and resources to help with the investigation. We pulled in scientific expertise from across our agency to focus on the epidemiologic, laboratory, and clinical realms. And we were working with many organizations across the country, at the state level, at the national level, and letting the public know what was going on as we were able to understand it. Our response efforts mainly focused on identifying and defining first and foremost the risk factors and the sources for e-cigarettes and other vaping products that were used in lung injury. As you may know, it is very challenging because, for example, we might get a web address. As soon as we got that web address, it was gone, literally. So identifying where these products came from was extremely challenging. Simultaneously, most of the individuals who were ill had used multiple products. There wasn't one flavor, there wasn't one particular product. They used both things that they got off the web, THC, but then they also used some of the more conventional products as well. We were detecting and tracking confirmed and probable cases with the help of all of the states and localities that were involved. And we were communicating that information on a regular basis. And then the laboratory studies began as samples came in. And that was really what helped us identify that the vitamin E acetate was particularly concerning to us. All of that information was being put out regularly to the public. I think sometimes there's a frustration that things weren't happening fast enough, but we really needed to know that our evidence was strong while we released this information.